School Kitchen Group Number 3.
Program Overview. Our program goal is to promote the importance of healthy eating and physical activity to lower the incidence of type 2 diabetes. Intervention will be in the form of an after-school program that will teach healthier eating habits and encourage participation in physical activity. Specifically, our program's target population is one middle school in East and South San Diego County. According to 2007 data, the South and East regions were higher than the overall county average of 54% for obesity. And since obesity is a leading risk factor for type 2 diabetes, we chose to develop our intervention for middle school students, ages 11 to 13, with BMIs that indicate being at risk for prediabetes. The after-school nutrition program will teach healthier eating habits and meal preparation, as well as encourage participation in physical activity while discouraging sedentary behavior. Study objectives. Through School Kitchen, we expect participants to increase the amount of fruits and vegetables per serving, decrease blood sugar levels and BMI, and create well-balanced meals. After 16 weeks of School Kitchen, at least 75% of participants will be able to confidently record their daily sugar intake in grams, organize a minimum of 3 balanced meals that correspond to the American Diabetic Association guidelines, and can create at least 5 well-balanced meals.
The model chosen to achieve this main outcome is the health belief model, a psychological health behavior change model developed to explain and predict health-related behaviors addressing perceived susceptibility, severity, barriers, and benefits, in addition to self-efficacy and cues to action. The key concepts of the health belief model that apply to our intervention include the belief that one is susceptible to a serious health problem, which is also called a perceived threat, and the belief that following a particular health recommendation would be beneficial in reducing the perceived threat. These key concepts from the health belief model apply to our intervention because we want to be able to inform the participants that they are at risk of type 2 diabetes and that diabetes is a serious health problem that can be prevented when following certain health recommendations. The main outcome we plan to measure is the increased consumption of fruit and vegetable servings, which will lead to decreased BMI and decreased blood sugar levels.
Outcomes. We are using a combination of methods to measure outcomes. The program will measure the qualitative outcome and components of the health belief model subjectively through the administration of a pre- and post-intervention survey. Then measure our quantitative outcomes objectively through both the BMI calculation equation and a one-touch glucose monitor.
Research design. Our research design is quasi-experimental in conjunction with a pre-test post-test design. Recruitment will be based on standard BMI measurements and a pre-test survey and a health assessment. Half of the students who have a BMI that is proven to show high risk for diabetes will receive the after-school program intervention. They will be our experimental group. The other half of the tested students with an at-risk BMI will receive a modified intervention. This group will be our comparison group. Following the intervention, a post-test survey and assessment will be administered to all students who had an at-risk BMI. After this post-test survey, evaluation of the program objectives will take place in order to compare the experimental and comparison group. Here is the current BMI chart. This is our quasi-experimental in conjunction with a pre-test post-test design.
Program strengths and weaknesses. Strength would be pre-test, post-test survey that ensures accuracy, and randomized comparison and experimental group to reduce bias. Weakness would be relying on participants' self-efficacy and lack of voluntary participants.